Look, it's really difficult for doctors to do interviews. I've had doctors literally walk out of an interview and apologise for applying. This has happened a few times to me, and I think I'm not that intimidating, surely. And so I think to some extent there is a tendency to overthink an interview, not just doctors, but everyone overthinks interview, thinking of what questions they're going to ask. And I'll answer it this way, I'll answer it that way. And it kind of misses the point because you're not actually looking for the answer. You're looking for how the person thinks. And so one thing that's really important to me is that I'm trying to get a sense of how they get on in the team. One observation I have of working with doctors is because they're the top of the tree, sometimes they don't notice there are other people in the room, and they want to be the most important, most impressive person in the room. So I'm looking for someone who's not necessarily that. I'm looking, and I've made mistakes. Okay, so I'm only saying this because I've employed people like that, and after I've employed them, I thought, oh my God, these other people that I've employed also have opinions that need to be respected, and views and ways of looking at things. So please, some respect for other people. So I'm looking for, and I guess the test for me is, would I like to work with this person? How would I feel working with this person? Are they too arrogant? Are they, too tentative at the opposite extreme? So I'm looking for their ability to fit in with the team, their interpersonal skills, I guess, and the interview is a good test of that. The interview is that's why the answers are not important. It's the way you relate in an interview that does it for me. The best interview you can have is where that feels like a conversation. It doesn't feel like question and answer, and you can't pre-plan a conversation. You can't pre-plan answers for that. So an example of a good thing to do in an interview is if someone asks you a question, to say, I don't really know what you're getting. I'm not sure I understand your question. Can you just expand on it a bit more? So that says to me the person's not arrogant. The person's trying to listen, trying to understand where you're coming from. I'm looking for what they believe in. I'm looking for whether a person thinks patient, thinks community, not just profession. And that's a risk of doctors, that they tend to be a bit absorbed in their own world. The ones that really stand out are the ones that approach a problem, a system problem from a patient perspective. So that's important. And how do they think? Can they think systems? Not just that one person, but can they put together pieces of information and think in terms of a system problem-solving exercise? And that's a hard one to get in an interview. So just a general point about interviews, I say to everybody, walk into an interview with 3 or 4 stories up your sleeve. 3 or 4 stories that illustrate a few points about you. Because again, anyone can claim to be empathetic, insightful, creative. They're easy words to roll off. Like I can claim to always love my children, but you don't know that. But you tell me a story of a situation where you had to deal with a difficult person, and mostly it is people, a difficult situation where you had to come up with a creative solution. I'm interested in that story. You've got me straight away, because it tells me that you're not just claiming to be someone. You're actually you're saying that this is an example of how I handled a difficult situation. So, or here's something great that I did with my team, and I'm listening for that all the time. What's your, are you claiming credit for everything that's ever happened around you? I want to know your role. Definitely, I want to know, what role you played in a change. But tell me it's all about you, and that's a big red flag to me. So yeah, don't walk in with pre-planned answers. Walk in with a few stories. That's your weapon that illustrate you. And I must say, I get really horrified when I even in senior interview panels where people ask questions like, "What would you do if?" And I hate those questions. I will never ask a "What would you do if?" question. And mainly because we can all invent stuff. We're all great at fiction, or hypothetical situations that might arise in the future. Whereas tell me a situation where you had to deal with a difficult doctor. What did you do? Or tell me a situation where you had to fire somebody. How did you do it? that's to me, that's a mature interview panel. And so I'm saying all these things, but recognizing that not the interviewers aren't always all that sophisticated. So even when they ask dumb questions like that, like what would you do if, I would pull it back to, well, let me give you an example when I was in a similar situation, and then that works. The interviewer will always be convinced about that because it's authentic. It's true. It's the truth. It's not made up stuff and not imaginary stuff.